Forensic medicine expert Professor Gerard Labuschagne says the COVID-19 pandemic is presenting hospitals with various challenges. He says under normal circumstances, healthcare workers are 4 times more likely than any other professional to be exposed to workplace violence. Well, what are the threats that hospitals are under, what should they be looking out for? Well, he joins me now for more on this story. It's a pleasure to have you with us tonight. It's certainly not the first time that we've seen hospitals and other facilities being used as the environment for which criminals want to walk in and take advantage of those that are in hospital. We've had several shootings, in fact, over the last year taking place within hospitals. So the idea of violence taking place there is certainly not new.
Yeah, I mean, it's a workplace like any other workplace, and will be, you will from time to time have these incidents, whether it's an outsider coming into your organization or somebody within the organization who is responsible for the violence. But I think what we're seeing with COVID is there's certain changes in the patterns that are taking place.
What are some of those changes?
Well, of course, we've seen a huge increase, and the President commented on it last night, in domestic violence. Now, of course, this means there's going to be an increase of domestic violence cases taking place being treated at the hospital, which means the perpetrator might then also come to the hospital and cause further violence. But, of course, amongst your own employees as victims of such gender-based violence, or the perpetrators. And that can, of course, then start to actually play out in your actual premises. So those are some of the risks. We've also got things like, family members having limited access because the hospitals are not allowing, as many visitors as they used to. So now you have frustrated family members who are not having access to their patient family member, who might, of course, get aggressive, who might interfere with infection control measures as they try to get access to their family member. And hospitals kind of have to look at ways that they can accommodate that by perhaps looking at online access, giving people in the wards iPads that they can have Wi-Fi access to their family members and communicate with them. So I think it's really, the hospitals have been so focused, of course, on the potential influx of patients and infection control, which is, of course, absolutely correct, that they haven't, I think, stopped to think about these other things, like, for example, cyber threats. There's been all over the world a massive increase in cyber attacks on hospital and healthcare facilities, which, of course, is disgusting, but unfortunately criminals will take advantage of whatever situations they can. So that's another side where not just hospitals, but any organization that has people now working from home and using a VPN system to get access to their employer's internet system, that again increases the risks for cyber attacks in most organizations. But as I said, very sadly, an increase towards hospitals.
What are the kind of things that hackers, for example, would be looking for when they hack into a hospital's system?
Well, of course, one of the most damaging ones is ransomware, where they basically lock you out of your actual system and do not give you access again until you pay whatever ransom or however you finalize it. The other thing, of course, in a healthcare environment, which is very sensitive, is healthcare patient data. And, of course, threatening to release such information on the internet unless there is, a payment made, for example. So that's the 2 types of things that appear to be the most common in terms, specifically hospitals nowadays.
Where do you think the greatest weaknesses lie in South Africa's hospital infrastructure and in the way that the system is set up?
Sure, I think like all countries, they're been overwhelmed with the number of patients. Any business kind of works on an average number of patients or an average number of people needing their services. Whether you sell something or provide a service, they work on kind of what's the average. And as soon as you overwhelm that, the system will inherently fail. And it's exactly the same for a hospital. If you're used to having X amount of patients and needing X amount of beds in hospital and X amount of intensive care beds, if you suddenly have a massive influx, that collapses the system. So that's, again, just I think in general. And, of course, that's going to put extra pressure on employees at hospitals. Ironically, to some degree, we've had, because of the closure of most elective surgeries, most healthcare facilities, until we get that influx of COVID patients, are actually having a massive financial negative impact because they're not having the same amount of income from treating patients as they normally have. And in some cases, hospitals have had to, terminate contracts with doctors or lay off certain healthcare or other employees because we're waiting for that influx of COVID patients and we're cancelling all the normal kind of patients we typically see, which is income for doctors and hospitals.
What are the kind of interventions that can be brought in at this early phase to almost, ensure that the situation does not have room to get worse beyond what we've seen happen in the past?
Yeah. Well, if we look at kind of the behavioral issues we started talking about in the beginning, are we training staff to manage aggressive, stressed out individuals? Are we training them to de-escalate people who are coming to the hospital in very stressed out and aggressive, perhaps, moods and states? Of course, if people start to harass the hospital ongoing, maybe an employee that's been dismissed from the hospital, do you have experts who can advise you on how to assess and manage this particular scenario? And hospitals always think of themselves as a place where they're to help. Why would people have negative feelings towards us? But the more we experience people under financial pressure because of COVID-19, people not getting the treatment that they normally would go for, and that includes people with mental health issues, we're going to see people under a lot of medical strain, financial strain, economic strain, relationship strain, and all of those are risk factors for increased outbursts and violent behavior towards hospital staff, towards families at home, etc. And that's again why we see the increase in domestic violence at home.
It's definitely such an interesting take on this matter. Thank you so much for joining us on News at Prime tonight. That was Dr. Gerard Labuschagne. Certainly an interesting angle to look into as far as the safety and the security of hospitals are concerned. And as he's mentioning all of those points, I'm thinking about the letters of distress that have been written by health workers themselves, even to Minister Zweli Mkhize. And clearly that may be a significant risk in and of itself if it is not attended to in time.